A local nursing home now able to access medical care for its employees long distance. This is called telemedicine, and Angela Veerville shows us how it works.
LVN Kathy Ortiz is a caregiver at Morningside Manor, but like many people who work in nursing homes, she can't afford health insurance. Good morning. So Morningside Ministries has provided a high-tech way for her to see a doctor when she's not feeling well without having to leave the workplace.
You got a cough or anything else going on?
A little bit of drainage and cough.
Ortiz and LVN Marlena Davis are connected via high-speed telephone lines to Dr. Byron Brooks at UT Medical Branch in Galveston. Using special equipment, Dr. Brooks can look inside a patient's ears, eyes, and throat, and even examine skin lesions long distance.
We check blood pressure, we check blood glucose, when you walk into our office, it's just like walking into your family doctor's office.
I think it's amazing that the doctors in Galveston, 200 miles away, can see inside my ear, down my throat, and diagnose me.
The telemedicine program has been in operation here at Morningside Ministries for about 9 months. As a result, they say there's been less absenteeism and improved morale.
Morningside believes that by taking care of their employees will become better caretakers. Angela Veerville, KSAT 12 News.
Hi, I'm Dr. Glenn Hammock of UTMB Electronic Health Network. We'd like to take this opportunity just to share with you some of the devices and technologies that we use to deliver diagnostic quality telemedicine anywhere in the world.
The UTMB Telehealth Center is the largest, most comprehensive telemedicine program in the world. Its primary charge is to make healthcare accessible to our patients, no matter where they live or what their age, no matter what the circumstances.
Sam, let me ask you, how's your activity level been? We're now 2.5 years since your bypass surgery.
Early on, UTMB doctors and technicians began using telemedicine to treat patients in the state's prison population. The program not only improved medical outcomes for patients with HIV, hepatitis C, diabetes, and asthma, it also saved the state more than $650 million. However, it is in the free world population that UTMB's telemedicine program has come of age, forging new frontiers at the speed of light.
Next to patients, we put one of these telemedicine carts or T-carts. We operate a fleet of over 200 of these in various locations across Texas and around the world. It's built to contain everything to deliver telemedicine care from a patient connected to any type of computer network and really get information back home to doctors here in Galveston or anywhere else these technologies can be put.
Deep breath, sir.
The whole idea behind telemedicine is that it gives the doctor the same basic information that he would have if the patient were in the room, only they can be thousands and thousands of miles away.
Another deep breath, please.
Patients from around the world can access our specialists through a network of UTMB clinics that are equipped with telemedicine technology. In East Texas towns like Liberty, or the string of small cities that perch on the Texas-Mexico border. From public schools where UTMB health professionals see children with severe disabilities. Even from the Antarctic and McMurdo, Palmer, and the South Pole stations. No matter where you go, UTMB doctors and patients are linked up via landlines, cable, fiber, video equipment, and satellites. Industry and corporate America have also teamed up with the UTMB telemedicine program.
Yes, he's already online.
In Galveston, American National Insurance employees have access to our physicians via telemedicine.
Still pretty sore.
Hi, good morning.
So do employees at Zachary Construction in San Antonio. 3 times a week during sick call, a UTMB doctor is on call.
Behind me is an example of the type of station where the doctors work, receiving information from the telemedicine carts. It has many computer screens that allow display of electronic medical records, things like high-resolution radiology images on a PACS system, and of course also the link to the patient location.
The experience was unbelievable. It's completely confidential, it's quick, it's professional, it's professionally done on both ends, from the medical assistant here to the doctor I was visiting with on the other line. It was perfect. I came up with a simple upper respiratory issue. Within 15 minutes I was done with my diagnostics. Another 15 minutes I was done with the doctor. So basically I was back in my office within a half an hour.
From San Antonio, Texas, to the high seas, telemedicine is anything but landlocked, and the potential for growth is limitless.
Well, from the near end, telemedicine is even useful between the clinic over in the family medicine building and a specialist office here on campus. It can be that simple to keep the patient from having to waste time walking back and forth between offices. And it can be used for as far away as the South Pole, or it can be used in space at the International Space Station.
It remains clear that even as we talk about faraway places, it's here at home that the full power of telehealth and telemedicine will be felt.
We can keep those patients at home where they want to be, rather than having to come into the hospital and perhaps spend a week, 2 weeks in a hospital bed for something that we might have been able to manage at home.
So just an example of the types of technologies that we use here every day at the UTMB Electronic Health Network.
We're bringing back house calls.